Welcome to Adapting Class, and thank you for deciding to watch this video. If you're looking for content mastering and test taking strategy, you are in the right place. Today, we're going to dive into more questions on the most commonly missed questions on my Q bank. Even the best nursing students struggle with this. So stick around. Let me show you some of the tricks and tips about these questions, how to tackle them, and which content to use. Most commonly missed questions on Adapting Class Q bank. Stick around and let's learn something. The first question, of course, is going to be a prioritization so that you can get your feet wet and figure out how to approach prioritization. I don't know what you have, but I said you have to be sharp, not expected. What does that mean? If you have 1 second, what would you do with these 4 patients? Which client should the nurse see first? Read it from the back and figure out from the beginning. A nurse is assessing 4 pediatric clients in the emergency department. Which client should the nurse see first? They are all 4 pediatric. Who are you going to see first? Divide the question into 2. Figure out the first situation, and then the modifier is what you're going to worry about, and you have to be sharp. Is it a breathing issue, electrolyte shock, sepsis, airway, neurological problem, and pain that you're going to lose your life? A 6 years old, time, date, age, I don't care. When it came to this situation with what? Tea-colored urine. What is that? Post strep glomerulonephritis. What does the patient have? Periorbital edema. At 3 weeks old, what is the problem? Diagnosed with tetralogy of Fowler. What the patient have? Clubbing of the fingers. A 13-month-old, history of what? Wheezing at home. Now resting quietly without wheezing. No more wheezing, right? A 5-week-old with a backing cough is coughing, backing. Oxygen saturation is 95. If you have 1 second, who are you going to see? Think about it. If you have post strep glomerulonephritis, you have tea-colored urine, periorbital edema, expected finding. Unless I see hypertension, I'm not picking you. That one is gone. 3-week-old diagnosed with tetralogy of Fowler. There's chronic hypoxia. You have what? Clubbing of the fingers is a chronic problem. It's not acute. If I see polycythemia vera or they have teeth spell, I'm intervening. A 13-month-old with a history of wheezing, you wheezing at home. All of a sudden, you stop wheezing. Silent chest. Buzzword. You got to pay attention. That is a priority. 5-week-old with a backing cough. You coughing and you backing is bad, but your saturation is 95. You have 1 second. Who are you going to give it to? All of them are priority. But as a entry-level nurse, pick with the one that is going to die quickly, the one you don't have time with. And as you can see, number 3 is the best answer in this situation. Number 2, content related. Do you know the live vaccines? I'll make a video regarding all the live vaccines and then the one that is acceptable for patients who are immunocompromised to use it, right? Eh, Which of the following vaccines are contraindicated in this client? Buzzword, contraindicated. That means you cannot take it. I've taken it. Select or apply. I'm not picking everything. If I'm confident, I pick it. See the way I'm approaching it. Contraindicated, that means bad medication. I cannot give it to this patient. Select or apply. That means I cannot pick all of them. I'm breaking down the question, right? A child undergoing what? Chemotherapy for leukemia. That means immunocompromised. I cannot give the patient live vaccine. We we need immunization. So no live vaccine. Look at this and ask yourself, which one is the live vaccine? Oral polio. Is it a live vaccine? Live attenuated influenza vaccine. I give this away. Measles, mumps, rubella. Is it a live vaccine? Tetanus, diphtheria, pertussis. Is it a live vaccine? HPV. Is it a live vaccine? COVID vaccine. Is it a live vaccine? What do you think? Think about it. Polio, the IM or II is the one that is not live. Therefore, this is a problem. Oral form is a problem. It's a live vaccine. Chemotherapy patient cannot get it. A nasal flu vaccine is a live vaccine. This is already giving it to you already. So they give it free for you. So you pick it, right? It's contraindicated. MMRI vaccine is a live vaccine. You cannot get it. Tdap, diphtheria, tetanus, pertussis is not a live vaccine. HPV is not a live vaccine. And all COVID vaccine that was created a couple of years ago are not live vaccine. There is no any acceptable live COVID vaccine available. Nothing has been made. All of them are not live. Some of them are MRI and other things. So they are not live vaccine. Therefore, this is safe. Which one you should pick? One, two, three. Those are the live vaccine. This patient cannot take it because it's contraindicated. Next question. Buzzword. Easy question, but it's difficult. Which of the following activities is most appropriate for a 8 years old child? Activities, play, right? Or toy you're using. When they give you a question like that in the pediatric, you have to master pediatric because it's the backbone of the NCLEX. Pediatric and maternity, always there. You find something, especially milestone, because you have to teach the mother. They have to know what to do with it. You have to teach a pregnant lady what they need to do. So master your maternity and peds. 8 years old, when you see this and they tell you activity, put them in a group. 8 years old is a school age group. School age, they cooperate with each other. Which game you think I'm cooperating? Playing make believe with toys. Well, there's no cooperation here. And there's leadership, right? Engagement in what? A simple game of pick apple is not cooperating. Playing board games with friends, yes, I'm cooperating with you, right? Engaging in solitude play with the sensory boy toy is not. You see how I answer? I just picked my buzzword and I said, I'm looking for cooperation. Number three is cooperating. That's your best answer. Which client should the nurse prioritize for immediate intervention? A client with serum of what? A nurse is reviewing the laboratory results of 4 clients. 4. Sodium, 129. And what is he complaining of? Nausea, headache. Potassium, 3.2. What is he complaining about? Muscle weakness. Calcium, 7.8. What is he complaining about? Tingling around the mouth. Potassium, 6.8. What is the problem? Peak T wave. I can tell you all are abnormal. But don't worry, look at the symptoms. I always divide it into two, the situation and the modifier. Sodium 129, you're going to have seizure. Seizures are very good, bad for you. It's very common for 129. But what is the patient complaining right now? Nausea and headache. It's not having seizures. Therefore, that's not a bigger problem. Potassium 3.2 is bad. You're going to have muscle weakness, right? Spasm and other thing. That's bad, right? Calcium of 7.8, experiencing tingling around the mouth. That is also a bad problem. It's having signs and symptoms of hypocalcemia. Potassium of 6.8 have peak T waves. All of them are bad, but there's only one person whose situation is bad. Elevated potassium and the EKG changes. That means there's end organ damage now. It's worse than you having tingliness around your mouth when you have hypocalcemia or you have small muscle weakness, right? Versus nausea and headache. All of them are bad, but 4 is in bad situation. So you always, that's how I said, look at it and say who you don't have once, you have 1 second. Somebody will pick the number 1, but he's not having seizures. He's having what? Nausea and headache. 6, no, number 4 already is potassium is too high, and now there's EKG changes. You go into cardiac arrhythmia and die. So you have to be sharp, not expected. The next one is EKG. How much do you know about your EKG? Which of the following nursing action demonstrate a correct understanding of your ABG results? All it means is, what should you do? A client is receiving assisted mechanical ventilation. It does not matter. Forget about it. Morning ABG. The question is about ABG. All these fancy words they'll put it around the question. Ignore it. What do you have? You have some patient with ABG, right? And then read your ABG. pH is 7.5, right? It's greater than 7.4. Therefore, this is alkalosis. You know this is an alkalosis problem. Now, what is causing alkalosis? CO2 is 41. It's normal. It's not that. Bicarbonate is 34. It has increased from 24. So this is what? A metabolic alkalosis. What should be the compensation? That means what should you do? Your alkalosis become acidosis and your metabolic become respiratory. Therefore, in order to compensate with this problem, right? In order to compensate with this problem, we're supposed to do what? What are we supposed to do? Respiratory acidosis. What is respiratory acidosis? I need to decrease your respiratory rate down. Okay, and that will lead to increase in CO2. Which lab work it shows that FiO2, if I increase it, is going to affect your oxygenation. This is not the problem. We're looking for ventilation. If you decrease PEEP, your oxygenation goes down. So FiO2 and PEEP are responsible for oxygenation. So the test taking strategy, the question is asking you, what should you do? Our saturation is 99. That tells us there is no oxygenation problem. So by test taking strategy, 1 and 2 is gone. Now you want to figure out what do you do with the respiratory problem. Decrease sedation to encourage what? Spontaneous breathing is not going to answer that question, right? We need to do what? Decrease the ventilator rate. Spontaneous breathing means you're going to breathe more, but we are supposed to decrease the respiratory rate so that our CO2 will come up and deal with the metabolic alkalosis. We want to create a situation of what? Respiratory acidosis. And respiratory acidosis is created by decreasing your respiratory rate or the ventilator rate. So 4 is your answer. A hard question, require critical thinking. There's a reason why a lot of people mix it. It's because of this content. This one, you know, I just put it in the table form. Don't worry, don't freak out. Just look at it and answer it. A client with latent TB that means PPD positive, prescribed isoniazid. It's one of the TB medication. And the patient now presents with what? Lethargy, confusion, and flapping tremor. Those are buzzwords. All TB medication can affect your liver. So if you come back with lethargy, confusion, and flapping tremor, we know that you have encephalopathy. That means bad problem. Your liver is damaged and you have a neurological problem. How do you manage it? Which of the following actions is indicated or not indicated? That's all. What do you think? We got to give you lactulose to take care of your ammonium. This is indicated. Ambulate the client to prevent DVT. A confused, lethargic patient who has encephalopathy is not moving. Prepare to initiate hemodialysis for ammonium removal. We don't remove ammonium with dialysis. We remove ammonium by having bowel movement, and this is not indicated. We need what? Lactulose. Administer a dose of acetaminophen to reduce the client's fever. Acetaminophen is going to affect the liver. More liver damage. Not indicated. Administer vitamin B6 as prescribed. This is antidote for what? Isoniazid to decrease peripheral neuropathy associated with it. So this is indicated. This is content-based. It's a table form. I know you know it. This is the reason why people miss this question, is because it's content-based and there's a lot of trap. This is the way you should prepare to answer the questions in the NCLEX, and you'll be golden. Next question. If you've never seen this before, it's okay. Don't worry about it. I'm going to explain it. What is the question? Go from the back. Read it from the back. Select or apply. Don't pick everything. Which of the following nursing intervention are appropriate during immediate post-op? All is asking you is appropriate right after surgery. What is the problem? A nurse is caring for a client who is post-operative following an open reduction internal fixation of the femur. Forget about it. If your femur is broken, I got to fix it. There is open. That means I got to make incision, cut through the skin to see the bone. Reduction. That means if the bone is displaced, the bone is like that, is broken, I got to line it up. Internal fixation. Then I got to put a rod to keep it in place. That's all. That is what we mean. Open reduction internal fixation. That means you go to surgery, there's an incision, they line the bone, they put the rod in place to keep it in place. Closed reduction, there's something we call closed reduction. That means we just reduce the fracture in the emergency room and we put the cast on it. Open reduction internal fixation does not need cast. That is the big difference. Closed reduction will need a cast or a splint. Open reduction, it has internal fixation, therefore there is no external fixation. The cast or the splint are external fixation. Therefore, what do you want to do? Monitor neurovascular status of the affected limb every 6 hours. Bad problem. Every 6 hours is too long. 1 to 2 hours. Those are the trap you should worry. The first portion of the answer choice is good. 6 hours is too long. Keep the client on strict bed rest for 5 days to promote healing. Promote healing is good, but if you stay in bed for 5 days, you're going to have DVT. Bad problem. Administer prescribed anticoagulation as ordered. We want to prevent DVT, so you get anticoagulation. It's appropriate. Encourage the use of incentive spirometer every 6 hours while awake. We want to prevent pneumonia. But what do? Every hour, 10 times an hour. 6 hours is wrong. It's 10 times every hour. Elevate the affected leg above the heart level for 48 hours. Elevation would decrease blood flow. That's a bad problem. Assist with early ambulation as correlated with the physical therapy. This will prevent DVT. We want to keep you mobile. So there's only 2 answers that are right. If you pick more, NCLEX give you 0. You know this. Don't get confused. When you see open reduction internal fixation, remember this video. It's what? I have to make incision. I have to seat the bone. I have to reduce the bone. I have to put a nail internal fixation in place and close the incision. Therefore, what do you think? It's different from close reduction. Close reduction, I need the cast or I need the splint. Open reduction, I don't need that. These are content you should be familiar with. If you need more, check out Dr. NCLEX. Next question. A nurse is preparing a client for cystogram. You may don't know it. Don't worry. I'll break it down to you to evaluate bladder function and structure. Which of the following considerations are appropriate? This is risk reduction questions. Teaching education. They said cystogram, and I give you idea looking for bladder function and structure. Every time you see gram, think about contrast. So I have to give you contrast. I have to put it in your bladder and look at it and put it in the bladder and then take a picture of it. Which of the following considerations are appropriate? I've already given you an idea, right? Assess for what? Allergy of contrast because there's a gram. Explain that the procedure involved catheter insertion because I got to put the contrast to your bladder, so there should be catheter in it. Inform the client that sedation will be required. Most of the time, there is no sedation, right? Cystogram is usually done in a radiology. They put a catheter and inject the contrast to look at your bladder. So there is no sedation. Encourage this is an outpatient procedure. Encourage increased fluid intake after the procedure. Every time they give you contrast, don't forget about it. You need a bunch of fluid to wash it out. Monitor for signs of urinary tract infection post-procedure because I placed a Foley catheter. Restrict oral intake for 6 hours before the procedure. You don't need to be NPO for this procedure. Therefore, which are appropriate is what? Assess for contrast allergy, catheter insertion, drink a lot of water to get rid of the contrast, and watch for infection. 3 and 6 are wrong. But you can see how it looked intimidating, but I know you got it. What is the most appropriate action by the nurse? A client is 24 hours postpartum. The nurse assesses the client lochia and note it is red in color with the fleshy odor. What is the most appropriate action? Notify the healthcare provider immediately, suspect a urine infection, document this as a normal finding, palpate the uterus. Look, when they give you OB question, don't worry, go for the buzzword. The buzzword will lead you to heaven, right? Buzzword, most appropriate. That means which action is appropriate. A client is what? 24 hours postpartum. That is the buzzword. She's 24 hours. There's a reason why I give you time. 24 hours means it means something. What should you expect the lochia to be? They told you it's what? Red in color and fleshy. There's a reason why. What do you do? 24 hours, I see this lochia. What do I do? You see, I'm changing the question the way it's written to my own. 24 hours, I see lochia. Is it good or bad? What kind of lochia? It's red and fleshy. That is an expected finding, right? You have lochia rubra, arbor, right? You can have serosa lochia. All is based on time. 24 hours, as you see, Lochia rubra. That means red in color and fresh in odor. Therefore, if it's normal, I'm not looking for anything. Document the finding and move on. Don't be trapped that I got to do something better, right? The question is asking you to answer what is asking you. Don't say, oh, I should check the uterus or call the doctor. Answer the question. A 24-hour lochia that is red and fleshy. Tell yourself, this is normal. I'm not going to get trapped. I'm picking right answer and not doing anything, just monitoring. 15-year-old client with grave disease has been prescribed methimazole. Which of the following findings may indicate the potential adverse effect of the medication? These require some critical thinking. I told you prioritization can come in different form. This is a prioritization. You have grave disease. What does that mean? It's hyperthyroidism. What should I expect? Everything is going to go up except what? Your weight. Think about it. What should you expect? In grave disease, all your symptoms is going to go up except what? Your weight. Your weight go down. That means that is what I should see. If I give you methimazole, your symptoms should try to normalize. If it's still the same, that means not working. But if I see something worse than what I'm doing, it's a prioritization. Remember, if you have grave disease and I give you methimazole, I can turn you into hypothyroid. So your priority is hypothyroidism symptoms, not hyperthyroidism. If you see hyperthyroidism, it means it's the same thing as grave disease. Your medication is not working. But priority is if I have overshot. Basically, I overshoot what I've been doing, and now you have a problem. So if I see blurred vision, slightly related to grave disease, right? Palpitation related to grave disease. Lethargy, your symptoms going down. That means I should be seeing outgoing symptoms. This means I have hypothyroidism. That's bad. If I see weight loss, that's what I expect. And as you can see, the priority function here is having signs and symptoms of hypothyroidism. Which one are you going to pick? If you have 1 second, you got to be sharp. Lethargy is your man. Thank you for watching. Working on mixed questions. There's a reason why even the good nursing students mix this, because it's a little bit trappy, but it requires content command. Command the content and stand on your ground. Don't get trapped. Adapt and class get your back. Thank you for watching and good luck in your exams.